And hello again, everybody, and welcome to COVID by the Numbers, our daily Facebook Live look at some of the data that we're getting on COVID-19 and its spread across the state. I'm Steve Irvin, filling in for Katie Rammel, who is normally in this spot. Katie is by now a little bit more of an expert than I am, so bear with me as we go through some of these numbers. As always, joined by Garrett Archer, our data analyst, to sort of break down what some of these numbers mean. And Garrett, let's start with our daily numbers, I guess, that we're seeing in Arizona. It does not paint a very good picture. We're at, we're approaching records or making records in some cases.
Correct. We are, so the number of new cases added today, 5,680. This would be a record number of cases added in a 24-hour period if it wasn't for that number we had a couple days ago, that 10,000 that came from Thanksgiving. So this truly is more of a 24-hour reporting record than that one was. This is bringing our 7-day average to the highest it's ever been, 4,780 cases. And it is, again, continues to climb. And our death number, 64. This brings our 7-day average for deaths up to 42 from 36 yesterday. So both of these metrics are climbing pretty quickly at this point.
And there's some numbers that I don't want to use the word alarming, but they're pretty concerning. Let's talk about the ICU bed numbers a little bit, because we're seeing probably fewer ICU beds than we've seen in quite some time.
Correct. So when we look at the number of ICU beds across the entirety of the reporting period, which begins on, this is, what day is this? This is March 26th to today. This is the highest number of ICU, well, let me put it a different way. This is we've only had one other day in this reporting period in which we had less ICU beds available throughout the entire hospital system. And that was at the very peak of our last surge on July 7th. And that was at when we had about 145 beds available through system-wide at about 9% headroom. We are again at 9% with only about 155 beds available, system-wide. The difference, of course, being that, as you can see, there are many more non-COVID-19 hospitalizations that are in the ICU at this point than there were during the July surge. And that's why we get to be a situation where we have less headroom and also still less ICU beds that are occupied by COVID-19 patients. We have 666 today in the ICU. At that July 7th number, that was the record, we had about 871 COVID-19 patients. So there's a lot more non-COVID-19 patients, but again, we're in a season where people require more hospitalizations.
Yeah, we've been talking about that for quite some time, is that the big worry in this second wave or first wave, depending on how you look at it, is that we're going to have more people in the hospital because of the flu, or we're going to have more people in the hospital just because we have more people in the state and more snowbirds and that sort of thing. And the other issue, of course, that we've talked about and we reported on is the fact that when we have these kind of hospitalization numbers and we start to hit capacity, there's not really a backup, because we're looking for more nurses and more medical professionals. Even if we have the facilities to open, we don't necessarily have the people to staff them, because there are so many other states that are also dealing with this in particular. I should mention that there's folks commenting already. If you have questions you'd like us to answer, legit questions about where we're going or what you're curious about, just chime in there. We'll try to get those questions answered for you, because I think this is a critical time when we look at ICU beds and when they're expected to hit capacity. Now we're basically looking at, Garrett, if I'm not mistaken, just before Christmas time.
That is pretty much right. So let me just go to where you're talking about that. So I've been not using the IHME data for projections for the past couple of days because it hadn't been updated, and it was updated on December 3rd, so it was updated yesterday. And let me just go through these projections here. I will bring it up right now. This is our projections from the University of Washington. And we'll go just right down to hospitalizations right now. We'll go to ICU beds. And here, this is what it's saying, is that here's our line of ICU beds available in the state. And as of right now, it does believe, it projects that we could hit our total max available ICU beds around December 22nd. That's sort of what its projection is saying right now.
And so at that point, we go to what we would call crisis standards of care, unless we can open up more capacity or something like that. And we know the governor put in some extra money for hospitals to be able to hire nurses. But as we pointed out, it's finding those nurses and getting those nurses into those hospitals. ER visits also on the way up here as well, which is an indication that more and more people are showing up at hospitals with symptoms and having some issues there as well. Can you talk about that?
Yeah, so we can talk about that really quick. So if we look at the hospitalization metrics for COVID-19, and we'll go to the COVID-19 ED visits here, you can see that our numbers right now, they have been rising for quite some time, and they're not quite at the peak, but they're getting very close to the peak numbers we had in July. Now, just a point on what these numbers are. These are number of positive or suspected COVID-19 patients seen in the emergency room department. So the emergency rooms, doesn't necessarily mean that all of these were admitted to the hospital, though some of them could have been. And these are people that came in, they had COVID-19 symptoms. They may not have tested positive. They just may have gone in and with these symptoms and been either administered a test or whatever happened at the hospital, but they could have been sent home with those symptoms. So just so we understand what these numbers are, but we can see that no matter what, we are seeing a pretty substantial growth to the point where we're almost at our peak in the emergency room visits right now.
When we talk about, there's a few folks commenting that somebody's got some agenda to shut down the state around Christmas. The fact is that we've reported, as we reported in the last couple of days, a number of major hospital systems, some of the major modelers, the NAU modelers, the UA modelers, all of those who are in the business of trying to project where we're going to go and what we're going to need in the next few weeks are all saying that these cases are rising and that we're getting into dangerous places. And they have recommended a number of things. Our agenda is simply to report those. And as we mentioned, the governor has decided that he wants as he put it, a more targeted approach, and he wants to, if he's going to close things down or take certain mitigation measures, that he wants to be able to do it where the problems lie. And so, there's a lot of disagreement on what the state should do next and that sort of thing. But in the meantime, the numbers tell us that we're certainly heading in that direction. Garrett, let's talk a little bit about deaths because. And peaks as well, because when we look at some of these things, we always have to keep in mind that we're talking about a 7-day moving average. So correct me if I'm wrong here, but when we talk about the numbers that get reported today versus cases and deaths, those aren't all necessarily from today. They're backfilled and that sort of thing. And so we really don't know, the most accurate trend until about 7 days later, right?
It could be as high as 18 days later or so. I mean, it really depends. That's the thing with COVID-19 deaths, is that because it can really range. When it comes to hospitalizations, doctors, modelers, and everyone else have a better idea of when there's an onset of a more moderate or severe COVID-19 case. They sort of already know the amount of days that it will require for hospitalization, and then they try to project out from there. Unfortunately, what can happen and what are the outcomes there. And there is some data on that, and we'll go over that in just a moment. I'm going to go over that death epicurve we were talking about right now, and we're just going to talk about a couple other things as well. This is the epicurve for today. One of the things that is different from these most recent reports that we've been talking about is that our deaths that are being added to the system now, and again, they're not, as Steve pointed out, when we see 62 deaths, it's not 62 deaths occurred today. In fact, as you can see, very few of the deaths that were added to the system today came from even the last couple days. It really looks like they come, as Steve said, about 7 to 10, and as far as 18 days out here. And this is what's causing the 7-day average, which stops at about 14 days, by the way, just to make sure that we don't always see this downward trend while they're reporting these numbers in. And you can see this thing is increasing right now. It's already sort of surpassed where it was in the early parts of the pandemic, and is on track, or at least on pace, with the other peak. Now, as a note of this, we do know from conversations we've had from doctors and from also medical data we have that the case fatality rates are going down a little bit, and that there are less situations in the ICU in which, we were talking to a doctor yesterday, and we said early on the ICU death rate was about 4 in 10. Four people that were admitted out of 10 people in the ICU for COVID-19 were going to die. And they've been able to get that down based on treatments and other things down to about 2 to 3. So I'm going to put up the AZDHS page really quick and just go over a couple things on these death numbers. This curve you're looking at is the same curve that we just already went through, but I really wanted to focus on ages right now. I wanted to focus on the case fatality rates and just basically break that out by age, because right now our case fatality rate for everything, and what the case fatality rate is for anyone who doesn't know, is it's a simple calculation of the number of cases in Arizona and the number of deaths. So the number of deaths divided by the number of cases. Right now, that in Arizona is about 1.9%. And if you look at this age data, anyone under the age of 55 in Arizona, their case fatality rate specifically is far under 1% at this point. But when you go into the older age groups, 55 and up, they have about a case fatality ratio of about 2.6%. And then 65 and up, that number goes to 11.8. And really just to touch on how serious the situation is with the hospitals, when we look at the hospital data and of people that are admitted to the hospital of these age groups, so about 13% of cases from the ages 55 and 64 are admitted to the hospital, and about 1 of 5 of those admittance have succumbed to COVID-19, so about 20%. And about 27% of the confirmed cases from the age of 65 and up will be admitted to the hospital, have been admitted to the hospital. And the number of deaths from that age group of those people who were admitted to the hospital is 43%.
So telling you something that we've known, but it certainly hammers home the important part here, that the older folks, especially people in long-term care facilities, especially people that have some underlying health conditions, you're obviously more likely to have those the older you get. Those are the folks who are really the most vulnerable here, the folks who most want to be protected, which is one of the reasons why long-term care workers and medical workers are among the first to get the vaccine. And there is a strong push to get that vaccine as quickly as we can into long-term care facilities as well, because we know that's really where we're seeing deaths, and that's where it's really going to be most impactful in terms of saving lives.
Yeah, and we do know, based on Maricopa County's health data that they provide, at least in the county, but we can likely extrapolate that outside the county, that, as you said, 81% of the deaths from COVID-19 have been from basically what they consider, the epidemiologists consider, the high-risk categories, which is anyone over the age of 65 or have a chronic medical condition or comorbidity. So that is definitely the highest risk group, and that's where most of the deaths are coming from.
Let's talk about our percent positivity. And I want to talk about something we touched on off camera a little bit. When we look at percent positivity statewide, not a good story, because we're actually seeing fewer tests, but we're seeing a higher percentage of those tests coming back positive. That's not a good combination.
Yes, and it's a very interesting combination too, because it's sort of not what we've been seeing in the last for this run up on this part of the surge. We've always had this corresponding lift in cases and tests that are going on at the same time, and now we sort of have the an opposite effect, in which we have less tests being conducted and more cases coming back positive. And we don't have an explainer or anything from the AZDHS as to why that is occurring right now. It has been occurring for about this last week since Thanksgiving. I don't know if it's because there's a lull in test processing. We just simply don't know yet. So we're waiting to see what that is. But as you said, Steve, 18%. That's what that's our best estimate for today's positivity ratio. We do have, say, in some of the counties, rural counties, like Graham County, for example, came back with a 41% positivity today. Santa Cruz at a 34%. And so there were a lot of counties out there. Maricopa County came back with a 16.8. But really, there are some of those rural counties that have very, very high positivity rates today. And that is also due to that these rural counties do more targeted testing as well. You don't have as many people just going out and getting tests in these rural counties that you do in, say, Maricopa or Pima.
Well, they don't have they don't necessarily have the test available and the resources to do that. So what you're saying basically is that percent positivity is driven up by the fact that people aren't just randomly getting tests; they're getting tests because they have some reason to believe that they've been exposed to this in their circle.
I mean, in Maricopa County or Pima, you can drive a mile away. You might have to wait for a while, but you can go to an urgent care and get a test pretty much anywhere. Or a CVS or Embry Women's Health or any of those places. In some of these rural counties, there's people that would have to drive a long time to get a test. So I could see how they would only test if they feel that they've absolutely been exposed to COVID-19.
Mobility index is something that we watch as well, because we don't have these mandatory statewide measures. We find ourselves kind of relying on people to do the right thing or do what they've been advised to do, at least. And the fact is that our mobility index seems to be sort of rising at the same rate that we're also seeing a rise in cases and some of these concerning numbers. So I guess the question becomes whether people are really following some of these guidelines or not, whether that's contributing to the rise in numbers.
Well, we do have. Mobility index is something that's been very interesting in the last couple of days. So today's mobility index, which is actually December 1st mobility index, because it lags a couple days, is 61 out of 100. So that's a pretty high mobility. However, there was a huge drop off in Thanksgiving mobility. So we haven't seen the mobility index itself hasn't really lurched ahead quite yet, but it could in the next couple of days as more data outside after the Thanksgiving holiday gets put into the system. So it's been very interesting to see what's happened with the mobility index. I'm not really sure where it's going right now, but it is increasing, but not to the point because it took such a drop off on Thanksgiving that it's going to take a while for it to climb above that again.
Garrett, I know we've talked about this earlier, but it's the subject that really fascinates me, which is this idea that there is a point of no return where we get to the point where the virus is so widespread that anything short of a full-on lockdown really isn't going to do you a heck of a lot of good, or at least isn't going to show results in reducing those numbers in the near term. There's no indication that this state is going to do that or even come close to that. But at some point, has anybody attempted to project in all the modeling that you've looked at, I guess, that sort of point of no return, or this point where it's not going to matter much anymore if we close down bars or schools or something like that? I mean, you look at the Maricopa County numbers and you look at the numbers that are in substantial spread and in the red. It doesn't really matter whether the school district's open right now. Most of these places have pretty substantial spread. So has anybody attempted to sort of answer that question as to,
I mean, that's a great question. And, what I see, we actually, this is going back to our town hall we had a couple days ago with Melissa Blasius, and we also had Will Humble and Dr. Sam Durrani from Honor Health, joined us on that. And we actually talked to something, somewhere, it's kind of in that similar vein. And what they talked about, what the doctor perspective was that we pretty much are at the point now that we're pretty much at the point of no return on the ICUs. He thinks that we're getting very, very close. And as I've said to Katie before, this gentleman, this doctor is not he's not prone to hyperbole that you might see on social media. And he does believe that in our hospitalizations, we have essentially gotten to that point with ICUs. He doesn't know about the inpatients, but he's saying that he's very concerned that they're going to have to start setting up very shortly those crisis standards of care in the next 2 weeks. And as we know with COVID-19 data, it takes about 2 weeks for anything. So if an entire lockdown order, shelter in place, just like we had in May, was added right now, and this is of course speculation because that, as you said, there's extremely likely to have no such order come into effect. But even if that were to come into effect right now, no difference really would be seen in the data, or at least in what's happening on the ground, for at least 2 weeks, because what we have right now, what's going on today, is already baked into the cake with hospitalizations for at least 2 weeks. And that's just the way it is. So whatever action anyone takes right now will only be reflected in the data for 2 weeks from now or so. So we're getting the short answer. I know that was pretty long, but the short-winded answer is that we're getting there. We're almost there with ICU, and we're getting there with the inpatient and other hospital resources.
And I may be getting into the area of stumper questions here, but there's another one that comes along, and if we don't have the data, we don't have the data. But I think the governor or the state health department, I can't remember which, announced today that we're going to start seeing vaccines in the state. The anticipation is somewhere between the 15th and 31st of December, we're going to see some of the first doses of the vaccine, and I think we're expecting to get somewhere in the neighborhood of 370,000 of those doses being made available. Those will go to the medical professionals and those on the front line, people that may be directly exposed to all of that. Is there a vaccine model out there, though, that gives us an idea? Because it would certainly seem to be that the governor and the state health department are placing a lot of faith in the vaccine itself to try and bring some of these numbers down.
There is, now that you say that, because this is one thing that the IHME model, when they introduced their update on December 3rd, they actually did introduce a rapid rollout projection. So let's go back to the IHME model and go through that, because this is brand new, just introduced yesterday. So I'm going to take out the other projections and just go to rapid rollout. So this is essentially the definition of what you're talking about. Vaccine distribution scaled up over 45 days. So what we have here is, and let me add the current projection to this just as a comparison. You can see that as far as the total deaths, it presumes that the rollout of the vaccine will make almost virtually no difference on the total deaths that we'll have in Arizona, and will only start to really impact that number well into March. When we look at the daily deaths, and again, I'm only going to go with masks. I'm going to remove masks. I'm going to remove easing so that we're only looking at rapid rollout. And again, this says that it's only going to start seeing a significant change in March. So far on our daily deaths, everything's pretty much, at least in these projections, the estimates are baked into the projections until at least March. So we go into daily infections. This is where we start to really see it change here. You can see, but again, with the projections, now that I've taken out the others, you can see it doesn't diverge until February. So that looks like that's sort of the narrative that we're seeing in all of these, is that we won't see a divergence, we won't see a change in our numbers until February, March, with the vaccine distribution.
And do those estimates at all try to estimate, I guess, the number of people who are willing to take this? Because to be honest, the polling that I've seen shows that there's a significant number of people out there that, for whatever reason, don't trust this. And part of the big reason that most people give is that it was developed so quickly. And we know it was developed quickly because the federal government stepped in and just poured billions of dollars into this, and basically took away a lot of the obstacles for private drug companies and that sort of thing to develop these kinds of vaccines. They could develop them simultaneously. They could spend $1 billion developing one that ultimately didn't pan out and didn't work, and the drug companies didn't have to worry about losing billions of dollars. And so there's a lot of reasons why this vaccine was developed so quickly. Cutting corners is not one of those reasons. No, these vaccines went through the same sort of clinical trials that any drug would, 3 different phases of clinical trials and thousands of people taking them. And so when we look at these different numbers and what's happening with COVID-19, the fact is that the vaccine is about as reliable as it can be, and it's already been tested pretty substantially. Now, people talk about a lot of these other things, but that's not enough to convince a lot of people. Let's just be honest with it. I think some of the polls I've seen show as many as 40% of the population doesn't necessarily believe that a vaccine is going to be effective, or at least they don't want to be the first to take it.
So I'm looking at this right now, and again, as you just alluded to, the best place to get this data is from polling. And all I can find right now, and I'm sure that there is, oh, hold on a second. I'm looking at Pew Research, and there is, now I'm looking at Pew Research. I just clicked on an article. Let me just bring this up, because Pew Research is really, it is the gold standard in surveys, especially for non-political research, they are the gold standard for this kind of stuff. So I just clicked on this article right here. Intent to get a COVID-19 vaccine rises to 60% as confidence in research and development process increases. This article was released yesterday, and we can see that that number was down to 51%. So this was what I was looking at before, was this 51%, but it seems it has now risen to 60% of Americans would get the vaccine, and about 39%, down from up from 49%, say they would not get the vaccine. So it does appear that confidence in the vaccine, based on the available data and information we've had over the past couple months, has increased pretty substantially, or at least by 9 points. And if it's on that current trajectory, we could absolutely see this continue to rise as we get closer to to 2021.
But overall, the message seems to be, even if we're getting large numbers of people in the population who are getting the vaccine, in order to get that the herd immunity that we're looking for that comes with the vaccine, it's still going to be a few months.
Oh, absolutely. I mean, as you said, the first people that are getting this vaccine are people who are constantly and directly in the line of fire of this virus, or are at most at risk, like the long-term care facilities and the healthcare workers. It takes, in fact, just another group, but New York Times actually had a very interesting article on where you are in line, to get this vaccine, and it shows sort of where you would be based on what the rollout is going to be. And for the most Americans, they're somewhere going to be in the middle of this, obviously. Which there's in Arizona, for example, when I check myself, there's 1.6 million people that are theoretically higher in line than I am to get this vaccine, simply because there are people who are doctors. There's the elderly, there's the long-term care, there's the healthcare workers, there's teachers, there's all these other people that are in line first because they're more directly in the line of fire of this thing. And since I'm able to sit here and do this broadcast from my house, I'm definitely not in the high risk group as far as being exposed to this thing all the time. Yeah.
I'm trying to share this screen, and I'm not sure if I'm able to very well, but let's see if I can get this up, because I've actually got the draft plan that the state health department actually came up with. Let's see what we got here. Wait a minute. There we go. You can all see that list now, I hope.
Yep. Okay. Yep. We can see it.
So this is from the draft plan that was actually put out in October, and this is not a final plan. We want to keep that in mind. You can actually see the word draft written right on it here. But when it looks at just who's in line and who's gonna get this, healthcare workers obviously near the top of the list. So that includes support staff, home health, pharmacists, EMTs, healthcare support operations, and school nurses. That's sort of the first wave of people, and they have estimates over here on the right side that show you, how many people are going to get that. If we're looking at 378,000 doses, realistically in December, these are the people who are probably going to get it. And some of these other folks may have to wait in line, depending on how many of those healthcare workers actually sign up and do it. But then when you get to like the second wave, that's protective service occupations. We had a question earlier. What about grocery store workers, retail food industry workers? They will be up there. Teachers and school staff also get some priority, and childcare providers. And then we look at the next wave, and long-term care facility residents, people with underlying medical conditions, people who are 65 years and older. And then you get into two, and that includes racial and ethnic minority groups, tribal facilities, correctional facilities, experiencing homelessness. So if you're in some of these groups, that's kind of where you are in line. But based on the numbers that we're seeing, you're probably not going to get a shot this month if you're not in that very first wave of healthcare workers, and it may be some time before you do. The good news that we have is that because of this enormous effort to build this vaccine, there's already doses in the pipeline ready to go, even sitting in warehouses regionally right now. And as soon as the FDA comes along with that emergency use authorization, assuming they approve this, then those doses can roll out relatively quickly, and that's been a part of the plan the whole time. Is we're not just going to approve the vaccine and then make a bunch of doses. We've already made them, and we're getting them ready to distribute, so we can do that as soon as possible. But it's interesting nonetheless. So what else am I missing, Garrett, in terms of numbers that we should be thinking about and be concerned about right now?
Let's go through the rate of transmission. Let's go through that via the counties. Let me share that screen here. I'm going to use COVID Act now for this one, just so we can compare Arizona specifically right now. So if we look at these numbers, right now Arizona itself this is presumed at a 1.18 rate of transmission, and then when we look at the different counties, let's put this. We'll get this in line here. Let me just view all of these. So you can see right now, Yavapai County is on the top of this, Mojave County. So really, there's a lot of the sort of the northwestern counties, Yavapai, Mojave, La Paz, Maricopa's at a 1.2 right now. It has gone down from 1.7. It goes all the way down to in Coconino and Graham at a 0.95 now. That's very interesting to see even one county out here in the lower than one at this point. But this is the best estimate we have for the different Arizona counties as far as what this rate of transmission is. This is something that we obviously all have to pay attention to. It is a little easier to use this data now. I was not using it for a while because of the Thanksgiving holiday, but as we're getting farther away from the Thanksgiving holiday, it's a little easier to use. Like, for example, the estimate for Arizona right now on RT Live is 1.17, and that's closer to the range that you would expect right now with these record days we're having.
And again, correct me if I'm wrong, but this is about the time that, or very soon at least, we're going to really see the impact of the Thanksgiving holiday on these numbers. Or are we already seeing it?
We're probably seeing it right now. So we're in this range. So we're going to see it really. Today's report, tomorrow's report, we will get a large report on a Saturday. Sunday's report, we probably won't see much on Sunday. And then Monday's the same thing. And then Tuesday, that's really Tuesday and Wednesday, and when we're really going to see Thanksgiving. And again, this is if Thanksgiving had any sort of real impact on these numbers. I'm not one to speculate that they will have impacts on these numbers. So this is just sort of the timeline of if there was an impact, whether it's up or down. We're going to see it probably up till about Tuesday of next week.
Joanne asks, are you two gentlemen going to take this shot? I'll answer that question. I don't know if Garrett wants to answer that question. It's everybody's medical choice. But for me, yeah, I will. As soon as I am eligible, I'm probably way down on that list. But as soon as I'm eligible, I'm going to get it. The FDA is the gold standard for approving vaccines. And I think we've all been preaching trust the experts and trust the science, and I'm not going to stop trusting the experts and the science now. So yeah, I will definitely be getting the vaccine as soon as I can. And we should point out a lot of people also are going to do that. We ran a story yesterday about how our three living presidents, Clinton, Bush, and Obama, are all going to line up and actually get the shot on camera, just to try to instill some confidence in people that this is a safe vaccine. So. Yes, I will definitely get it.
Yeah, I'm also going to be getting it. Yes.
Yeah, and this is a question from Jackie. She says, Garrett, Steve, have you heard how they might get the vaccine to people that don't drive and are over the age of 65? I haven't heard specifics on that, but I can tell you that every comment that I've heard about the rollout for this is that it's described as the most massive government operation logistically since World War II, basically, in trying to get this vaccine distributed. And so given the priority to people who are immobile and in long-term care facilities, my guess is those people won't be burdened with having to leave those facilities, but the vaccine will likely come to them. So that's my answer on that question. There was some question about the R naught that I wanted to get to a little bit, because I know earlier in the week we were kind of saying we can't necessarily rely on some of these numbers because there have been some glitches in the data. Have we fixed that at this point?
Well, I would say I was just touching on that. I would say that we can start looking at the R naught again, and I'll bring it up right now because we're sort of out of that, that 10,000. that really would have, made a lot of noise in the data. And with the Thanksgiving holiday prior to that having very low numbers, it really would have caused a lot of noise. So we're about 3 days out from that now. So there's enough data in the system to start to stabilize this number. We are at 1.17. We are back at the top of the tier here. At this top area, you can see our error bars anywhere from 0.9 to 1.17, or excuse me, 1.38 is where they think we are right now. And that, said we do have a couple states now. We do have a growing number of states here that are now at the green again. You can see a lot of these states are on the Midwestern area. It seems there's a lot of Midwestern states there. And again, it's hard to tell if all of these states all have the same reporting eccentricities that we do. So it's one of those times where it's like, do we really want to compare everything at this very moment? I know just from knowing Arizona data that it's likely stabilized here, but I can't say the same thing for Minnesota. I just don't know. So hard to really put us on this. What does the high red bar mean? That's where they think our estimate is at the highest. So they believe that the high red bar means that our highest could be 1.4. 1.38 could be what the highest transmission is, and our lowest could be 0.9. So what they're saying is we're 80% confidence, because this is done with an 80% confidence rate, that the virus is very likely spreading, because there's only a very small part of that error bar where it's no longer in the spreading. It's starting to go down again. So like you say, for example, in Oregon with their 1.4 estimate, which is incredible, the 80% confident rate for that is that they're confident that no matter what, the virus is spreading, and that there's no scenario in which the numbers are going to go down. In Arizona, there is a small scenario that the numbers could start going down. That's what the easy way to interpret that.
There was one other question here, and I'm looking for it now. And it was a question about just how long the vaccine is good for. I don't think we know that question yet.
I don't think we know that question either yet.
I mean, all of the experts we've talked to, I don't think we know exactly how long the question is. I think from everything that I've heard from some of the people that we've talked to, at least, is that the hope is that we get COVID-19 sort of to the same sort of manageable level that we have with the flu. And that means that, yes, we will still see people die probably every year from COVID-19. The flu vaccine comes out every year. We take that flu vaccine and it's modified in order to account for some of the different mutating strains of the flu virus. But the bottom line is that when we get the vaccine and get it to a manageable level, we'll probably still see tens of thousands of deaths in the U.S. every year. But the difference will be we won't have hospitals overwhelmed, and we won't see those deaths in the hundreds of thousands as we've seen this year. And so, I from every expert, I guess, that we've talked to, I think that's the general hope here, but they're still trying to figure out exactly how long this is going to be effective for, how the virus is going to mutate. And a lot of that is sort of the inexact science of trying to predict the future, and not necessarily easy to do. Projections, I guess, for the next several weeks, Garrett, there's no sign that you can see in the data that any of these numbers are starting to go down. Am I correct on that?
You are correct. We don't have anything to indicate that numbers are going to be going down quite yet. In fact, if anything, the numbers appear that they're going to be, we're going to be hitting some more record numbers here, only because we still have a fairly large gap in the case numbers here from Thanksgiving weekend. So we could still be seeing higher numbers. If I look at the cases per day, you can see that we're still adding cases from November 23rd. We have this pretty sizable drop down in just this last week that is still likely going to be filled in. This is I mean, this could indicate a drop, but I highly doubt it. It does appear that these numbers will continue to fill in, and that we will reach this sort of 5,000 range in all of these days, and likely for the next week preceding. So, but again, it's hard to tell. We could be seeing the very beginnings of a drop in this, but I'm just not really. I'm not confident in that right now. Just yet.
And we should point out again, as we pointed out at the top of this Facebook Live, that we won't know for
Correct.
7 to 18 days exactly when our peak was. We'll be able to look back and say our peak was, but when we hit that peak, we won't know necessarily in that moment.
The good thing nowadays is that we didn't even know where our peak was in the summer until a good like 3-4 weeks after the peak occurred, because the lag in the test, the state was simply not prepared for the number of people getting tested back in the summertime. And so we didn't know where the peak was until, gosh, I'm going to say like 3 weeks, 3 or 4 weeks. Now we have a much better understanding of where our peaks are and our valleys with this, and we're getting them within 4 to 5 days now. So if a sizable drop in COVID-19 begins to emerge, the good thing is we're going to be able to detect that within a week of it happening. We'll be able to say, look, we are on a downturn. Like, for example, Navajo Nation, while they're still putting out some very high numbers, they are on a decline week over week. They're at about 20% less cases this week right now than they added last week. So that, and the Navajo Nation is very good about making sure that they get as many tests in as possible. And because of that, we're seeing, and they usually lead, the Navajo Nation has been sort of a leading indicator for Arizona of about a month. So, there's a good chance that within the next 3 weeks or so, we could start seeing some downturns.
We would hope, and we certainly hope we get there. We certainly hope the vaccine will allow us to get back to some sort of semblance of normal. And I think it'll be interesting how it's rolled out, interesting exactly who takes it. And it could be interesting as well, just how many businesses and institutions and so forth are going to tell people, look, you can't come in the building unless you've had it. So all of those things will be interesting. Again, that's predicting the future, and we don't want to speculate on it too much. But nonetheless, to sum up, I guess we're looking at some rising numbers, some continuing numbers, possibly hitting records. And as always, folks, please wear a mask, social distance, stay at home if you can. Try to avoid those large gatherings, all of the things that we've been advising you to do. Let's try to all do our part to keep this from spreading anymore. Garrett, as always, thank you. I appreciate your time. And once again, we're going to see you again on Monday, I believe, with another look at some of the numbers. And we'll be taking a look at just exactly where our state stands in terms of this battle against a pandemic that's been with us for about 9 months or so. Thanks once again, and we'll see you on the other side.